Good evening, everyone, and welcome to BioVanguard Cell Talk presentation. For today's session, Madhuri is our presenter, and she will be delivering on the topic real-world evidence for association of vitamin D supplementation with atherosclerotic cardiovascular diseases in UK Biobank. So before the presentation, I would like to introduce Madhuri. Madhuri holds a bachelor's degree in microbiology from Ramlal Anand College, University of Delhi, and is in the final semester of her master's program in nutritional biology at the Central University of Haryana. Her academic journey has honed her expertise in microbiological techniques, food quality analysis, and the core principles of nutrition science. Through this fellowship, she is looking forward to acquire advanced scientific and research qualities which will help expanding her knowledge base and empowering her to contribute to high impact scholarly publication as well as aiding in thesis writing. Now I welcome Madhuri to start with her presentation.
Thank you so much. So good evening, everyone. My topic today is association of vitamin D supplementation with arteriosclerotic cardiovascular disease. So let me begin with, as we all know, that cardiovascular disease is a very common problem nowadays, and it causes a lot of mortality globally, and it is a causative agent in Europe as well. Now, what is arteriosclerotic cardiovascular disease? It is a part of the huge types of cardiovascular disease already. It is characterized by the development of plaques of atherosclerosis in the arterial vessels in the arterial region, with ischemic heart disease and ischemic stroke as clinical manifestation. So, how is vitamin D related to atherosclerotic cardiovascular disease, even called as ASCVD? And it is being said in this acronym in this whole study, in this whole paper. So, vitamin D, we already know it is a very it has a good impact in immunity. It regulates immunity and homeostasis, and it has anti-inflammatory properties as well. So some studies have established already that yes, if you consume vitamin D, there is an inverse relationship to the CVD risk. But the real world effectiveness is yet unknown in the previous studies. The reason can be because of small studies, because of small scale of participants already taken, or any other reason. So how this flow of this paper goes on is vitamin D supplementation is given to the patient, and then it was observed that if they have shown some risk of ASCVD or there is no risk, it depends on that. So if there are risks, then they are being suggested to reduce. And because of lack of evidence in the real world effect, this paper has been utilized for that. So how the paper continues is they have selected people from UK Biobank population concerning only for the European population. So initially they have taken around 5 lakh of people, but excluding the people without baseline studies, baseline measurement, or without information on vitamin D supplement use. And then finally they are being excluded depending on if they're already showing some, they have any diagnosis of arteriosclerosis or any other risk factors already. So finally, the studies came out to be, the participants came out to be around 4 lakh, more than 4 lakh participants. And their baseline characteristics were already being established. And the point to be noted is it is a mixed study. That is, they have taken female participants and male participants as well. But the sex-based effect is not being checked in this paper already. So how the paper goes is that material and methods study design was aimed to assess the association of self-reported regular vitamin D supplementation. So they have self-reported for vitamin D supplementation as well as the 25-hydroxy vitamin D levels, which is the precursor of vitamin D supplementation, and incident ASCVD and symptoms in case of European population only for population-based cohort study. And now for the data collection, they have taken people from especially in the age range of 40 to 69 years old. Their blood, urine, saliva samples were taken up, and finally they have taken the follow-up as well. And vitamin D consumption, multivitamin use were taken. The values were taken according to questionnaire they have mentioned in the questionnaires. Then the serum 25 OSG levels were measured using chemiluminescent immunoassay. And the outcome, if they have shown any risk factors, they are being checked by primary healthcare system along with that. And the covariates are taken, including demographics, that includes age, sex, their lifestyle, they are consuming anything, they are consuming alcohol, smoking, if they have been affecting results. Then the statistical analysis are being done, subgroup analysis, sensitivity analysis are being done accordingly. And two models were there. Model 1 is adjusted for age and sex, and model 2 was including all the different covariates, which was more than 40, around 48. They are being taken, and model is being prepared. Results, they have categorized on the basis of serum 25 OSG level. So more than 100 nanomole per liter is a high value, and 50 to 100 nanomole per liter is a sufficient amount of vitamin D levels and serum 25 OSG levels. And less than 30 nanomole per liter is a deficient amount. And over half of the study population were either, they have shown that yes, vitamin D deficient population is a very high number, and its deficient values are also a high number, which is around 34.4%. And there was very little amount of people who have very high amount of 25 OHD levels, which is a precursor of vitamin D. Regarding vitamin supplementation, only 4.3% of the population have reported that yes, they consume a regular amount of vitamin D. While a higher proportion, which is around 20.7%, consume a very low dose of vitamin D via multivitamin products or any other sources of vitamin D. So what is the relationship? What they have found out about the relationship of serum 25 OHD levels and the risk factors of ASCVD. So they have shown that yes, after the follow-up of around 15.9 years, they have done the follow-up of the patients they have already selected. There were 11.6% of participants who had shown that yes, they have ASCVD, or they are showing the risk factors, which is ischemic heart diseases or cerebrovascular disease, respectively. And less than 30 nanomole per liter of vitamin D, which is a deficiency amount of vitamin D, that has shown a risk of total ASCVD and individual risk factors as well. So this clearly shows that if there is a very low amount of serum 25 OSG or vitamin D level, then that is a directly proportional to the risk of ASCVD, cardiovascular disease, atherosclerotic cardiovascular disease. As well as they have also shown that possible relationship of vitamin D consumption and ASCVD. So in comparison to non-use or the people who are not consuming vitamin D completely, they have a statistically significant value of having ASCVD risk factors. And additionally, the other risk factors as well, which is directly or indirectly is positive agent of cardiovascular disease factors. So these are the this table clearly mentions that if there are two models which are being taken. So according to that, if the deficiency is in a high number, so they are directly proportional to the arterial vascular disease as well as ischemic heart disease, cerebrovascular diseases, atherosclerotic disease, and peripheral arterial disease. But in case of insufficiency, the value is a little bit lower, but it is not a significant difference is there. So yes, we can consider that yes, during insufficiency as well, there is a direct proportionally, they are related to each other. That not directly, I would say, inversely related to. If there is vitamin D status is high, then our risk factors are reducing in the same way. So this graph is clearly showing, this is a diagrammatic representation of how the hazard value is shown. That if the optimum value is there of 25 hydroxy vitamin D nanomole per liter in the serum, then in the around the 70 to 80, we can see that it is touching the median value. So the hazard ratio is very high when the vitamin level is very low. So and it is again in a hazard area when the values are increasing. So the optimum value is around 60 to 80. So final conclusion of this paper is, it is showing that yes, the people who are regularly consuming vitamin D, they have shown a reduced risk of ASCVD, which is the particular focus of this paper, and along with that, the other positive agent of cardiovascular risk factor or heart diseases. And we can confidently say that yes, vitamin D supplementation has a real world effectiveness as well, for especially for the UK population. And similarly, it is true for dose response analysis as well. When they are provided dose accordingly, the individual with 25 OHD levels below 60 nanomole per liter may profit from vitamin D supplementation. So this is the conclusion the paper is showing, that yes, supplementation is very important factor for reducing the health risk factors. And measuring of 25 OHD status before starting vitamin D supplementation is highly recommended and is very much requirement for the UK population. But what are the limitation of this paper? So first of all, yes, whenever there is population-based study and people are volunteering for that, so one drawback of that is healthy volunteer come first. So that is a problem. If it is a randomized trial without any biases, so that would be more better in the future studies. Accordingly, questionnaires were used in this paper and self-reporting, so that can cause information bias as well. Thirdly, there were lack of details concerning the dosage, the frequency, and what are the chemical properties of vitamin D supplements in the overall method. And next, which is very important, that this study was basically done on UK, United Kingdom people, European people. So we cannot generalize this data for the Asian population or the American population. So that is a drawback. So we need to do the accordingly study for that region, and because somewhere or the other genetic factors are affecting the cardiovascular disease factors. So finally, this is the reference of the paper. Thank you so much.
Thank you, Madhuri, for the presentation. Audience, if you have any questions, you can type in the chat box. Okay, I don't see any questions. Thank you, Madhuri, for the presentation, and I thank everyone for attending the session.
Thank you so much.